So what we're gonna do right now is we're going to concentrate on the glabella area right here. This is like the 11s. You know, some areas, some people it's more pronounced than others. One great thing about it is the line is not creased there, is by injecting to prevent that from happening. The other thing which we're going to do is we're going to do some in the forehead. And the forehead is it's interesting in that what you want to do, you want to soften those lines, but you don't want to make that initially completely flat. The one problem if you try to make that too flat is it pushes the eyebrows down, which you don't want to have, and then it looks angry or sad. So what we're trying to do, we'll put a little bit just to soften it, so when you raise eyebrows, it doesn't crease that vigorously. So we're going to start in the glabella area right here. Okay, I'm going to have you frown for me for a second. Good, relax it. And right in front, that's just so we can see where the muscles are. Okay, we're going to inject this side first, right side. Okay, good. And a little bit on the left. The one good thing about Botox is that the needle used for is a 30 gauge. You know, it's a really small needle. It's about the size of a hair, so discomfort is pretty minimal with it. Okay, now we're going to do the forehead. Now raise your eyebrows for me. Good, relax. Foreheads are always a little different. Everybody's forehead is a little more because some foreheads are more broader than others. Some people have more lines on the forehead. So the pattern of injection does vary a little bit depending upon the shape of somebody's forehead or where their lines are. Okay, very good. Raise your eyebrows. Good, relax it. And what happens is usually what I like for patients to do is for the next hour after we do Botox is having to use those muscles. About every 5 to 10 minutes we try to use those muscles, and what it does, that just forces the body to take the Botox out better. So it just works better. If you don't do it, it will still work, but that just enhances the effects of the treatment. And what I'm going to do now is I'm going to put a little cytoactive on. What cytoactive is a hyaluronic acid gel. And what that does, it just reduces the risk of bruising. This is not a heavy bruising procedure, but when you do that, it just reduces the risk of it. Some of the old theory was that you couldn't lay down after you had Botox, and that probably doesn't really matter, but the important thing is to use those muscles, because when you use those muscles, it really does increase the effect of the, enhance the effect of the Botox. Okay, so that's pretty much a standard treatment we use for the glabella and also the forehead area. Sometimes, once again, the forehead, depending upon the shape of somebody's forehead, you vary maybe a little bit more, a little bit less, and that's individual. Men tend to take more than women do, but that's pretty standardized treatment for that area.